got this. You're on mute, right?
Yep.
Good morning, everyone. We are showing 11 a.m. sharp here with the Jefferson City School District for our Back to JC Schools Reentry Plan discussion and live stream. We want to thank everybody for joining us, members of our staff who are here this morning, parents and families from across the district and other community members. We have a few participants joining us today. So I'd like to introduce them now quickly. We've got our Superintendent, Dr. Larry Linthacum, here on the screen. We also have our Chief of Learning, Dr. Shelby Scarbrough. Our District CFO and COO, Jason Hoffman. Our Director of Health Services, Chad Sooter. And Chesney Schulte from the Cole County Health Department. So since Monday, when we announced this live stream, we've been collecting questions from staff and family members, and we've compiled them into some of our most common themes. And so what we're going to do is start off today by having each of our participants give a brief overview from their area to address some of those most common questions. And then we'll move into the Q&A. Just to give you an idea of what our schedule looks like today, we'll do the overviews and Q&A more directed towards our staff and employee questions for the first 30 minutes, an hour, and then we'll move and reset into questions from families and students for the second hour from 12 o'clock to 1 o'clock. So first, we'd like to turn things over to Chesney Schulte to discuss the current status of COVID-19 in Jefferson City and Cole County. Thanks, Chesney.
Thank you for having me on. Hello, everyone at home, and thank you for the introduction. So cases in Cole County, currently we have 87 active cases across Cole County. That number that you see on our website is the number of people who have an active infection, those who are still under quarantine by the health department. So we'll kind of walk through contact tracing in general and what that number looks like in a little bit. The other numbers that I want to address that you'll see on the website is the total number of cases that we've had, which obviously is a number that will continue to climb because that number will only go up. The number that we like to look at, though, is that active number, which is those currently testing positive, currently with that infection. Another one that is important to note is the positivity rate. And that is the number of Cole County residents that have tested positive out of those who have been tested. So that number right now is about 2.7%. And so basically for every 100 residents that test for COVID-19, 2.7 of those are testing positive. That is an important number to keep in mind. That is very low. Also, that the number of people tested in this county are primarily those who are symptomatic because it does require a physician's order to get tested, and the physicians are really reserving those tests for individuals who are symptomatic. So that's something to consider with the number that you see in that positivity rate. As far as the contact investigation goes, I'll just kind of walk you through that process very quickly. Whenever a lab gets a positive COVID-19 test, the lab notifies the physician who ordered that lab. At the same time, the lab also notifies Department of Health and Senior Services. Then the physician notifies that positive person who's tested. At the same time, Department of Health and Senior Services contacts that health department where that individual resides. So when we learn of that positive test result, we do reach out to that individual. We want to learn from that positive case what symptoms they were having or what prompted them to get tested, when those symptoms started. And then we look back 2 weeks prior to say where that individual could have been exposed to the virus, whether they had recent travel exposure across the state or across the country, or known contact with a positive or symptomatic individual, or if they have no known risk factors of where they could have contracted COVID-19. The next piece of that is learning who they could have potentially exposed with their virus. So CDC guidance says that that is started 2 days prior to their symptoms starting, meaning that if an individual becomes symptomatic on a Wednesday, we would go back to Monday and learn Monday, Tuesday, Wednesday, all the way until the time we're talking with them, what activities they might have had, who those close contacts were. And CDC defines that as anyone who's within 6 feet for 15 minutes or longer, starting 2 days prior to symptoms starting and then walking forward from there. And so that's kind of the piece of contact tracing. With that positive individual, they will be under quarantine by the health department for 10 days after symptoms have started. On that 10th day, we also want to learn, have they been fever-free for at least 24 hours and have they had improvement of symptoms? And if that's the case, then 10 days after symptoms have started, they will be released from quarantine by the health department. They are not required to test negative before returning back to normal activities. As a matter of fact, CDC has found that individuals will continue testing positive for quite some time. And that does not indicate that they are infectious at all or that they're contagious, but just that that dead virus is still trying to get out of their system. So that's why we don't encourage individuals to get retested, because there's no scientific data to support that. For contacts to that positive case, the quarantine period is 14 days. And that's because it's the incubation period of the virus that we're looking at that point. And so it indicates that after exposure, you might become symptomatic and test positive from 2 to 14 days after that exposure. So that's certainly a point of confusion for individuals who hear 10 days and hear 14 days. There really is scientific data to support both of those. It's just that they're referring to different aspects of that virus. The 10 days is the infectious period versus the 14 days is the incubation period of that virus. And I believe that was the main questions that I was to address early on. Is there anything you'd like me to speak on now, Ryan?
No, I think that's good for a start, Chesney, and I know you're going to try to stick with us as much of the 2 hours as you can. So if you're here for the Q&A portion, we'll throw some questions to you. And if not, then if you have to step off, we understand, and we'll welcome you back for our second hour to do another intro for our student and family section. So I think we are good for now. Thank you, Chesney.
Thank you.
As an FYI for everyone watching, the Cole County Schools have been working closely in conjunction with the Cole County Health Department since our closure in March. So we really appreciate and value having had that relationship where we, as school districts in our county, along with other health experts, can get together regularly, talk about the conditions, and certainly appreciate having your advice and guidance now as we get back to school. So next up, we will turn things over to Superintendent Dr. Larry Linthacum, who's going to give us an overview of our Back to JC Schools reentry plan.
Thank you, Ryan, and thank you to all the participants, and thank you for everyone that is joining us. This from 11 to noon here is regarding our staff. So if ever there was a time to be stronger together, now is the time. So thank you guys for joining us, and thank you for all your efforts as these reentry plans, as we are definitely in uncharted waters of times that we've not been in, and coming together collaboratively is so important. So thank you for everyone. I might a little caveat here, if we do not address any questions or concerns that you might have, please don't hesitate to reach out to us. We tried grouping them into categories because we had so many questions, but we recognize there may be something that we possibly do not address. It will not be intentionally, but as we look at our time to try to cover all these. So I encourage you to ask, email, stop by, a cup of coffee, any questions or concerns that you might have going forward. Being the theme of being stronger together, we surveyed our staff, we surveyed our families, and overwhelmingly, the response was that the people were ready to get back to school. You cannot replace face-to-face, being in seat, as far as being in our schools, and just overwhelmingly, our folks have shared that, not unanimously, but most of our folks, including staff and our families, have said they were ready to go back to school. We went through a process over the summer to consult with those folks at the local, the state, the national health experts with the status of COVID and whether it's safe to return to school, and it's ever changing. It's a moving target at time, but the one target that does not move is just the safety of our staff and of our students going forward. So we've looked at other school districts, had many conversations across the state and across the country, and looking at what they were doing to return to school and trying to take what applies to us while it also aligns with our local and county officials. So with that, with the organizations, associations, and other education entities, we used all of that information to compile and then prepare our own reentry plan. So there's basically 7 parts of our reentry plan. I know we shared this, released it on July 15th. It just starts out with sanitation and cleaning to ensure a clean learning environment to minimize as best as we can the germs in our schools. And so that's something kudos to our custodian, our maintenance folks of what they're doing and that we'll continue to do. And as we work together to ensure a clean buildings that are sanitized going forward. The second part of that is just social distancing. That is something that is important. 6 feet when possible. And if not possible, no less than 3 feet based upon the CDC definition, DESE, the Department of Elementary and Secondary Education, and the Missouri Health Department recommendation. So that's an important part of social distancing. The third part being screening measures. So that's an important part. Our staff, our parents, when we ask our parents, the number one factor that they said they would feel more comfortable of having school if we did some screening and the temperature check. So that's something that we will be doing here in all of our buildings going forward. The personal protective equipment, as we discuss masks, or we will be, I know there's some questions about that and we'll touch on that. So that's an important part of that, of the personal protective equipment, that we'll get into that here in a little bit. The limited visitor access. We do believe we're stronger together, but we also realize that the safety of our staff and of our students is important. So we're going to limit that. And they'll be talking that at each respective building because each building has a different role and that can look different at different levels. Number 6 is just the virtual education. We know that we've had some parents and families that have shared they are not comfortable with our reentry procedures, and we respect that. And some have opted not to come back in seat. So that's a part of that as well. And then the last one being just procedure for what will take place in the event of a positive case. Chad Sooter, Shelby, Scarbrough, they'll discuss that in more detail here later, but we need to make sure have those steps in place as well. So there is one certainty that I think that we can all agree. There are varying opinions on almost every single topic here that I've touched on, that the rest of our folks will be touching on. And there's varying opinions from healthcare professionals as well. And we ask for your patience. We have a responsibility for the well-being of our students and our staff. We've tried finding a balance to open our schools safely and responsibly while also taking care of our students and our staff. So again, we know there's varying opinions. We've had many conversations. We'll have many more, but we do believe we're stronger together. We believe we have an opportunity to come together as a school community as we work through these. So that's kind of an overview. I've got some specific questions that you have asked that I'll respond to here later, but that's kind of an overview. And again, thank you guys for joining us today. We believe we're stronger together, and here's just another avenue for us to be able to come together and share with you kind of where we are. So Ryan, I'll turn it back over to you.
Thank you, Dr. Linthacum. And we just want to take a second to remind everybody who's watching that our Back to JC Schools Reentry Plan with the key priorities that Dr. Linthacum just covered, it's available on the homepage of our website, www.jcschools.us. That was released back on July 15th. So that is a good place to start to follow through and remind yourselves of those key priorities. Also, a quick reminder that we're live here on YouTube now, but as soon as we complete this live stream, this video will be available in its entirety for anyone who wasn't able to join us in this moment, or if you want to go back and watch it again, you have to step in or out. You can watch the live stream in its entirety on our YouTube channel at a later time. And next, we're going to welcome Dr. Shelby Scarbrough. She's our Chief of Learning whose position includes the Human Resources Department and Special Services Department. She's going to cover many of the questions that we've received from employees about employee leave, procedures in the classroom, and things like that. So welcome, Shelby.
Good morning. I'm happy to be here with all of you today. I think the burning question is, what is school going to look like with all of these procedures and protocols that we've put in place? And I think it's important for everybody to not forget why we do the work that we do in educating our students and giving them a fun and engaging place to be. But it's also important for us as educators on why we are here, who we surround ourselves by, and how we work and navigate difficult situations. Two words I've used through the whole closure were fluid and flexibility. We have to be able to pivot at any moment, and we have to be willing to change based on the needs that are before us. So when you look at everything is changing every day, there's new statistics, there's new suggestions, there's new ideas on how people can do school. And I think for the most part, if we put procedures in place and we confidently lock arms together, socially distancing, of course, we are able to execute our plans that we've put in place. Our goal every day is to provide meaningful and engaging learning opportunities for our students. How do we do that? When we put our plan together, we sent it back to our building administrators and said, use your people, decide what works best for your building. You know your students, you know your staff, you know the layout of your building. Amazing things are going to happen this school year, and I'm confident on August 24th, on the first day of school, we will have procedures and plans in place, and we will also have to change some of our procedures and plans. But we're doing it from a good place of intent to make sure that we're providing a safe environment while we're still able to teach and learn in our classrooms. One of the things that has come up many times is, can we go outside? What are the small cohorts? What is it going to look like at lunch? What is it going to look like in the hallways? I can't speak to every single building today, but I do when I've asked administrators, looking at traffic flow in the hallways at secondary buildings, what is lunch going to look like? Are you coming together as groups, or are they going to be escorted? Are you going to eat lunch in the classroom? Those are all questions that you want to make sure you have answered by your building administrator. Our goal and expectations are to make sure that we are still able to socially distance, and when we can't, we wear a mask. In our elementary classrooms, we have small cohort units in those classrooms, socially distancing, removing furniture or pieces of furniture that aren't necessary so that we can still provide socially distancing opportunities where students can still engage with each other and learn. UV light and sunshine are the best medicine for this virus. When we want students to go outside, we encourage staff to take their students outside. Some of the schools have even came up with creative spaces outside that classrooms can check out the spaces so that they can go and learn outside. One of the other opportunities that students will have, they still will be able to have recess. Again, every school is coming up with procedures on what that's going to look like and how they divide out the classrooms on the playgrounds, the equipment that they're using, and what those safety protocols are when they go outside and when they come back in. We know that this is overwhelming. For some, it is terrifying. And we have to recognize that all of us are navigating this differently. So while we are worried about what our students are going to do, we also have to worry about our colleagues and how we can support them. Self-care is extremely important, and we don't want to lose sight of that. We need to make sure we reach out to others who may be struggling, who may not understand, or who come from a place of fear. Fear is usually from a lack of understanding. So if you are experiencing a lot of overwhelming feelings, we encourage staff to reach out to their supervisors, reach out to the HR department, reach out to Chad Sooter so we can help arm you with information to help minimize your fears and help you troubleshoot any situations that you may be finding difficult. We know that learning has to take place, whether we are in seat or if we happen to have a closure. Building administrators will also be reviewing with staff what those expectations are going to be like should we have a short-term or an extended closure. Learning will take place every single day. And if we all know that and are committed to that, learning will take place every single day. We have to make sure that we don't lose our why on why we are here. When we get hung up on the processes and procedures and we don't understand them, we want you to ask. We want you to seek clarification and ask questions. But I challenge everyone who does have questions to also have solutions. Everyone is doing the very best job they can with the information that they have, and everyone is willing to step in and collaborate and find better ways to do things if they're in fact better ways that we should be handling all of our procedures and making sure our students and staff are safe. I encourage you to reach out to the HR department. One of the biggest questions that we have is about leave. How is that going to impact me if I'm impacted by COVID? Through our Safe Schools trainings, we send out information on emergency paid sick leave, which you are entitled to up to 80 hours if you are a full-time employee, which equates to 10 business days. If you have been impacted by COVID, there are 4 areas that are outlined on the information that we send out to all of the employees. And we have a process for employees to follow so that you are given that leave when you are impacted by COVID. If for some reason beyond those 10 days, you have been awarded leave, that you are able to use your awarded leave, and outside of that, you can apply for FMLA. And should the situation merit itself and you have to be docked, the docked rate is at your daily rate of pay. Many people have asked, what if I'm exposed at school? Is that a workers' comp claim? How is the district going to pay for my expenses? If you feel that you were exposed at work, we will take you through the workers' comp process where you can apply, and our insurance company will do the investigation to determine the outcome of your request if it's a workers' compensation claim. We also want to remind everyone that when we do have leave, everyone's situation is different, which is why it's very important to reach out to your supervisor and reach out to HR when you have questions, how it might be impacting you, what are your options, and we can work through that with you. There isn't a blanket statement that's going to apply to everyone, so we want everyone to make sure they know where their resources are when they do have questions and who they can reach out to. I appreciate the opportunity to talk about what learning is going to look like and what school is going to look like. And I cannot say it enough that we can do hard things and we can make sure that our schools are safe, fun, and engaging for not only our staff and our students. Thank you.
Thank you, Shelby. Appreciate that. Jason Hoffman, our CFO, COO, is here this morning as well. Within his umbrella in the district, fall custodial maintenance and transportation. So obviously those are a few areas in which people do have questions. We've asked Jason to join us today to talk about some of our cleaning procedures, transportation procedures, things of that nature. Go ahead and take it away, Jason.
Thank you. So it's true, Shelby has trademarked fluid and flexible. We hear it every day, maybe every hour. But I think another saying, the Commissioner of Education last week in one of her speeches said, in order for us to be successful this year, it's going to take a tremendous amount of grit and grace. And she's exactly right. And I've seen a tremendous amount of grit from everybody that's been working on this plan. And we know it isn't perfect, so we're looking for some grace and going to make it better. But I think we've put together a pretty good plan. As far as cleaning, the cleaners that have been delivered to the buildings and classrooms, they are intended for use in schools, health clubs, grocery stores. They're FDA approved for virucidal use, a new term that I got to add to my vocabulary, one of many. And it's the same type of cleaners and wipes that you'll find at the entrance of a grocery store, for example, to wipe down carts, child seats, cleaning tables, etc. We feel very good about the product that we've purchased and don't feel like we'll be putting our staff or students at risk for using this. During the school hours, the custodians this summer have received additional training and new expectations. Things are going to look different for a custodian. And so during the school hours, custodians are going to thoroughly cover high-touch services throughout the building on an ongoing rotation. And in every bathroom, there's going to be a pad where they're supposed to time the last time that was cleaned. And they're going to go in there and they're not cleaning the toilets thoroughly, but they're cleaning all the high-touch surfaces, and they're supposed to time that. And so that way, anytime someone is in the building, they can see when the last time that bathroom was cleaned, and they have a rotation that they'll be working through the building. So they'll be coming through several times a day and hitting those high-touch areas. There'll be the water bottle fill stations, doorknobs, entrance, exit handles, handrails, walls. In addition to the signing, the time in on the bathrooms, we're also developing a checklist that anytime some member of the administrative council is in a building, we're going to have a checklist going through and identifying we're all doing what we said we were going to do. Principals will have this. So we're just trying to ensure that what we've put in place is being done. Social distancing, that we did a thorough evaluation of every single classroom throughout the district. And we had to do that for a couple reasons. One, we reduced the capacity of every classroom. And we then said, how many students do we expect to be in these classrooms to make sure that we could fit the number of students in our reduced capacity that we had come up with. And then we also needed to do that evaluation to say, we had tables in a lot of rooms, and that's not going to work if we're going to try and keep students distanced. So we had to do an evaluation of what tables do we need to remove, how many desks do we need to order. And so we ordered about 1,500 additional desks that are scheduled to be delivered at the end of next week. And so that was a very detailed, difficult project to work on. But something that's going to help us with our social distancing is the fact that we have about 16% of our students that have signed up for virtual. So we have about 1,400 students, and it's split evenly through all the grade spans. And we did a budget amendment this week, and so that's an additional cost of $3 million of tuition that we're paying. And we haven't reduced our number of staff members, our teachers, at all. So just think about our classes that we have. Basically, all of them should be reduced by about 15%. So that will help with being able to space students out. We've purchased a tremendous amount of signage. We have social distancing signs, mask reminder signs, hand washing signs. Those have all, they haven't all come in. We're getting the last group in next week, but they will all be delivered and up in your buildings by the time school starts. Transportation, where the number of virtual students is helping. Obviously, we have 16% fewer students. We have fewer riders. We've also encouraged parents to bring their students to school if possible. So we just finished routing and talked to first student today. And we actually have 26% fewer riders than what we had the first day of school last year. So we basically have a quarter of the capacity. We still have the same number of buses. So we've increased the capacity of our buses by 25% basically. Putting other measures in place. We're going to load from back to front to keep students from intermingling with one another. We have seating charts. We're going to be requiring them to gel in and gel off the bus. We're requiring masks on buses. And we have also purchased a new product called Z-Pass, which has a scan. When a student gets on the bus, they will scan on the bus, and then they will scan off the bus. So should we need to contact trace Chesney, that'll be the first thing we're able to go to is say, was that student on a bus? If so, then go to the seating chart for that day, or just go see if they were on that day. So it should help quite a bit with contact tracing should we need to. And then finally, food service, that's going to look a lot different. Breakfast is going to look similar across the grade spans. We're bagging breakfast, so students will get a choice of a couple breakfasts. So and they'll be at different spots within the buildings, but they will get a bag of breakfast and then a milk handed to them separately. And then lunch. We are not using the cafeterias for the most part, so students will be serving throughout the buildings at the elementary schools. The secondary schools are coming to the cafeteria in groups of 4 classes, getting a prepared tray. So it's going to be different than before. They would go through a line and say, I would like this, I would like this, I would like this. Instead, they're going to say, I would like this option of a tray or this option of a tray. And it's going to be pre-prepared. They're going to take that tray, they're going to be handed a drink, and then they're going to take that back to the classroom. And then to be truthful, the first week, our meals are going to be fairly basic as we're trying to work through all of this, and we're going to continue to add more and more variety. But the menus, I've been told, should be up. The menus and the nutritional values are going to be on our website, hopefully today. So I know there are other questions that are later, but Ryan, I'll hand it back to you.
Thank you, Jason. Before I move on, I know we've gotten some questions already on the YouTube channel about Launch, which is the virtual option for students. We will get into a little bit about Launch later, but from a high level, The most important thing to know in the moment is that there's information about how families can enroll and launch on our website on that same page with the reentry plan. You do have to be registered as a Jefferson City School District to participate in launch. So if you've applied for launch as a virtual learning option, but you haven't registered with the district, you do still need to reach out to your student's school and be sure that you're registered. If you haven't heard from someone from your school yet, you should be hearing from them soon. And then if you've heard from the school, you've applied and you've been approved for launch, we will be in touch next week with more information to get you materials, what to expect as a participant in launch, how to pick up your device, and other things of that nature. So we will be communicating directly with those families who are choosing the virtual option. And now I want to just move on to the last participant, which is Chad Sooter. He's our Director of Health Services for the district. He joined our district last year and came to us from Capital Region Medical Center. So suffice it to say, it's been really helpful to have his health knowledge as we navigate COVID-19, the relationships that he brings with our local health entities like Chesney and the Cole County Health Department. It's really been invaluable. So thank you, Chad, for talking about some of those specific health concerns in that area.
Thank you for the introduction, Ryan. I appreciate it. Sorry, I had to step away there for a second, but basically my job is to help our students and staff with the help of our district members to come back into a safe environment. So one of the things that we are doing, you have heard that we have all these layers in place. And those layers are outlined in the reentry plan. And so I'm going to just touch base as an overview of some of those layers and how they work whenever they're introduced into the school. And so I will talk more in depth about some questions later on in the session, but just wanted to give you an idea of, like, for instance, you've heard about the thermal scanners, and students and staff will walk through those whenever they arrive at school. Those thermal scanners are just as a first step precaution to try to capture anyone with a temperature or fever or anything along those lines. But they're not the only defense that we have. So basically what happens is if someone walks through those thermal scanners and they become positive with an elevated temperature, they will be pulled aside discreetly and sent to the nurse in order to be evaluated and triaged accordingly and scanned with an FDA-approved thermometer. Because there's reasons why there's an elevated temp. It's not necessarily because of illness. They could have been on a really hot bus. It could be over 100 degrees outside. They could have ran to school. There's many different reasons for an elevated temp. And so I've got a great group of nurses that work for the district, and they are ready to field those questions, and they are ready to support your child to make sure that, is their temperature elevated for a reason, or is it because of an illness? That's what the nurses are there for, is to evaluate it. So that's our first line of defense. Another thing you hear us talking about a lot is masks. And so earlier in the conversation, it was mentioned that masks will be worn by students and staff whenever social distancing cannot be maintained. Again, in the media and out there on various sites, what is the true social distancing? Social distancing, as outlined by CDC, is at least a minimum of 6 feet. However, the Missouri Department of Health and Senior Services, along with DESE, we have noticed that in some classrooms, we're not able to maintain that 6 feet of distance. And so with the known droplet protection or caution, I'll talk about that in a second. With the known droplet caution, if we can maintain a minimum of 3 feet, we can still have a safe environment for our children and our staff while wearing masks. And so where did the 6 feet come from? So usually a droplet is a form of how a virus is transferred. And so right now, COVID is what's considered a droplet form. It is not airborne. So what that means is whenever it's expelled out of the mouth, it will travel for up to about 3 feet and then drop out of the air onto a hard surface, the desk, the floor, wherever there's a hard surface for it to land on. So the 6 feet minimum distance is if you get a power sneezer or you get someone that can really expel some droplets, we know for sure that a 6 feet distance is safe. However, we also know medically that the droplets only travel 3 feet. That is where the 3 feet minimum distance comes in for the classrooms, to allow for that spacing to educate our children, yet still keep them safe. Another question, and I believe this is addressed down lower, but I get a lot of questions about air purifiers. People that want air purifiers in their rooms. And the thing is that this is a droplet form, which an air purifier will not filter that because it comes out of the mouth and directly down to the floor. Whereas an air purifier is more for pollutants in the air, and this does not stay in the air long enough. So that's something to consider as well when we're looking at air conditioning in the classrooms. Another thing to look at is that I want to touch on is the contact tracing. Okay, I've had a lot of staff members ask me about contact tracing, and believe it or not, we have had many contact tracings already, just in the last couple weeks, but we work very closely with Cole County Health Department. I can tell you that my dealings with Chesney at the health department have been awesome. So basically what we do, I can't give you a black and white statement on how that will work or who will be notified, because we are at the mercy of the parents notifying us, as well as staff notifying us that they are a positive case. So there might be a positive case that we might not know about for a day or so, and we will address that, and we will contact trace as quick as possible. So what happens is when I am alerted of a positive case, I have a list of questions and procedures that I will go and check with staff or students, reach out to that student, gather the information, and forward that information to Cole County Health Department. We will then talk it over together on the phone for recommendations on how we address it in the school. Do we close down the classroom? Do we close down a wing? Do we need to close down the entire school? It's one of those things that I can't give you a black and white answer because it is situational. And then another thing we have to be mindful of is that we have to work together in this. So what happens is if we get an employee that's positive, we can't alienate them and not be with them through this process because they didn't want this. They didn't ask to get it. But we have to make sure that we are a team together to help them get through this. And that's why we are working closely together with the health. That's why working with the health department and us as a group, we are able to help clear a school or help clear a situation very quick so we can get back to our new normal for our children. Let's see if there's anything else. Another thing that I wanted to touch on, and this is just something, and this will be the last thing I mention before we get into our Q&A, is to look at things through another lens. And the reason why I say that is because we should never downplay someone's anxiety in regards to COVID. How I'm feeling and how someone else feels might not be the same, but I do not have the right to downplay how they're feeling. So with that in mind, we also have to be mindful that there's a lot of fear coming back to school, a lot of fear putting our students back in school, but we have so many layers in place that our schools are going to be a safe place. Can I guarantee 100% that we're not going to get it? No, but I can guarantee 100% that when we are aware of it, a process will be given so that way we can mitigate the risk of spreading it to others. One thing you have to ask yourself, and I've spoke to a few teachers about this, is people are scared to come back to school, but how are we looking at our daily lives? Are we going to Walmart? Are we going to Target? Do we get gas at the gas station? Are we hanging out with our friends on the weekends and not wearing masks? Are we going to parties? How about our kids? Our kids are running around the neighborhood. Our teenagers are running around with their friends and they're not social distancing. We also have to look at all of that to where coming into the schools, it's controlled. Okay, we have all these layers in place to help protect you. And so some of this anxiety is, well, I can't go back to school because I'm going to get it. You have to look at your life outside of school as what have you done to put yourself at risk for getting that. So it's just something to see things through a different lens, that not to take away your anxiety, but to see things as a different way, that you might have exposed yourself prior to coming to school. But while at school, we have so many layers in place, we try to make it as safe as possible. So hopefully I didn't talk over my time limit, but I just wanted to make sure I shared some of that information with our staff. Thank you.
Thank you, Chad. That's very, very helpful. So now that we've gone through each of our participants, giving an overview, trying to address some of those most common questions that we've received, we'll move on to the Q&A portion for our staff member first hour. And we've got 20 minutes here, so we're good on time. Just a reminder again that we are trying to address some of our staff questions here in the first hour, and then we'll move on to family and student questions in the second hour. I also want to mention that we know, we released our reentry plan on July 15th, and we certainly know that we have a few areas where we need to provide more information here in the next week before school gets started. Obviously, the majority of our staff are coming back on contract here on Monday. So we do want to reiterate and encourage you to work within your buildings, work with your building principal. We'll have more information for staff members about expectations next week. And we'll have more information for everyone about our plan for distance learning in the event of a temporary or extended closure. So Chad, really quick, since you were the last one to speak, I want to jump. We've had a couple questions come in about this topic, so I know it's a popular one. Questions about students eating meals in classrooms. If they can't be socially distanced or they're closer together and they're not wearing masks while they're eating, how do we accommodate both at the same time?
In regards to that question, our classrooms should be or will be set up to allow for social distancing with the minimum 3 feet. So whenever students are eating lunch or breakfast in their classrooms, if they're sitting at their desks, they should still be at that 3 foot minimum distance. I know some classrooms might be set up to where our littles might be sitting on the floor. Again, they will still be social distance enough to be able to eat and maintain social distance at the same time.
Thank you, Chad. Next question will go to Superintendent Linthacum regarding mask enforcement. We've said that for those students that need to wear masks in certain instances, how will the staff be expected to enforce the requirements of wearing masks for those who are required? And what if the student refuses to wear a mask or purposely does something like cough in someone else's face? How will we handle those situations? And will the district provide masks to students and staff?
Great questions, Ryan, and thank you for that. Our principals will be working with their staff on specific situations with regards to that. We are going to expect our staff to help ensure that our students are safe, which includes wearing a mask for our specifically our secondary students when they are not able to ensure that appropriate social distancing. I think more importantly, we'll be asking that you help our students and our families see the importance and the why behind wearing a mask. Just for that safe environment. And we know there's varying opinions on that, but your building principals will be working with your staff on that. We do recognize and realize there will be a learning curve at the beginning and reminders for our student and staff as well. And we're asking for some grace at the beginning of the school year and ask to remind our students when they're not wearing a mask. And if it becomes a habit of certain students not wearing a mask, as you work through your building principals, I would recommend contacting a parent guardian, discussing it with them, the importance, the why behind it. And the specific question there, Ryan, you asked if a student purposely coughs in another student's face. Personally, I would handle that in the same with other classroom management skills that you have as a teacher and address accordingly with the classroom expectations you have, grace, but also accountability, but also consistency. And we're encouraging our principals to work through their staff at respective buildings, so we do have consistency with that. But specifically on the mask, we will provide 2 masks for every staff member, and we will have extra disposable masks available. Our student masks will be part of their student supply list, But if students forget their mask, we'll provide them with the disposable mask, or if they are not able to have their mask, we'll work with them to get them a mask. No different than if a student's unable to bring a pencil to school and so forth. We'll work with them as we will in the past. So at the end of the day, we want our students to be successful in a safe environment, and that will including with the wearing of masks as well.
Okay, thank you, Larry. Next question. I know, Shelby, you covered this in your introduction, but it's certainly something that's on the top of the mind of our employees. We've received a lot of questions about leave. And if an employee uses their 10 extra COVID days and all of their sick leave on being quarantined because of being exposed at school, will they be docked pay? How much? What happens then if your child gets COVID and you need to stay home? I know you covered this, but if you wouldn't mind just going back and talking through it in detail again, because I know it is important for our staff.
Absolutely. And first and foremost, it is extremely important when you encounter an opportunity where you have to use your leave, that you work with your building administrator or your supervisor and contact the HR office so we can help you navigate that. Every situation is different. And so it's very important to make sure that you know what leave you have available to you and how to use that leave. With our emergency paid sick leave, as I mentioned earlier, full-time employees have 80 hours, which equates to 10 days. And it is prorated. I didn't mention that earlier, prorated based if you're a part-time employee based on the amount of time that you are working. If you have a COVID-related issue that requires you to be able to use emergency paid sick leave, that is 10 days. If you have to extend your leave beyond that, you would use your own awarded leave that you're given, which is 10 sick days and 2 personal days. Outside of that, if the leave continues, it does fall under our FMLA process. FMLA is up to 12 weeks of leave, but it follows the same process. You use your awarded leave and then you would have docked pay at your daily rate. The caveat to that is if you happen to make a workers' comp claim, it is founded that you did contract the virus at work, then that would be a percentage of your pay that you receive while you are quarantined or out of work. So again, it's not very, there's not set steps for everybody, but the set steps is that we do have emergency paid sick leave available to our employees. There are criteria which every employee has been issued through our Safe Schools training and a document that we provided, as well as all the leave that is awarded to you. And anytime you have questions, feel free to reach out to our office.
Thank you, Shelby. I know that's something that the Human Resources Department will be available and supportive. Talk to your supervisor, reach out to Human Resources if you have questions. Okay, the next question, which I will push to either Chad or Chesney, since she's still with us. And I'm sure the first thing you would tell us is to rely on the data that we're seeing from the local level, from the Cole County Health Department. But we have had questions about since there hasn't been a decrease in the number of new positive cases for 14 days as recommended by the CDC, how is it safe for us? Schools in Boone County have postponed based on their average of daily new cases per 100,000. You talked about the positivity rate per 100,000. Some people look at the new cases per 100,000, and Boone County is at about 13. Cole County is at about 19, whereas districts in St. Louis and counties are closer to 21. So just talk to us a little bit about the guidelines that you're using here locally to make data-driven decisions about the safest way for us to get back to schools, if you wouldn't mind.
Ryan, I'll go ahead and field that question, and then Chesney can fill in any gaps if there's anything that I'm missing, if that's okay. Basically, if you look at our community right now, we are still functioning as a community as one. We are still out and about. We're still enjoying the outside. We're still enjoying everybody's company. We're still doing our social distance. We are doing everything for our new normal that we can. We are not Boone County. We're not the other counties. So I can't speak for how they're doing their operations. But what I can say is that we still have a couple weeks before school starts. And so anything can happen. I can't predict that, but the virus is still going to be here in September, just like it's here in August. So delaying school will only delay our children, our students, our staff getting back to a new normal and meeting with their cohorts and having a structured education setting. So that is my feedback on why we should continue to stay on an August timeline for starting school. But again, we still have a couple weeks. Anything could change. But if there's anything I'm missing, Chesney, can you fill me in, or are we good there?
No, I think that's a great point. And we do want to look at our overall cases per population, which is still considerably lower than Boone and certainly much, much lower than St. Louis County or St. Louis City. So that's a number we're looking at too. Another thing that we can evaluate with our new cases is where that exposure occurs. And we do our best to say, see what risk factors that individual might have had. And I can say that a lot of the cases recently have still been a result of contact to a positive case. And probably second in that tier would be travel around the country or around the state. And so that is reassuring when you have especially contact to a positive case, because many of the cases that have become positive are a result of one, and they've already been under quarantine, aware of that exposure. It's kind of the ideal situation for anyone testing positive, that we already got their name, we've already talked to them once, and we know that in that 14-day period, they became symptomatic and they've now tested positive. So that's always a reassuring origin, I guess, of those positive cases. And then Chad makes another great point. Never in the closures for the state of Missouri, never for these preventative measures was the goal to ever eradicate the virus. That's an impossible goal, and we understand that the virus is still here. And how long would we choose to close schools? How long would we choose to keep our kids out of the seats and see the other public health ramifications that are going to be a result of those school closures and of the other things that we've done in response to COVID-19 across the country? I certainly don't think that it's those things. Certainly the risks of having our kids out of the seat, the risks of postponing certainly don't outweigh the benefits of having our kids back in school now. So I'm excited to get everybody back. I think it's a necessary thing to do as a parent, as a community member, as a nurse, as a communicable disease nurse as well. So I think now is the time, and I'm excited and supportive of this.
Thank you, Chesney and Chad. And I know that that is a topic that we will likely visit in our second hour again, just in case we have families who join us that aren't here for this first hour. The next question I want to pose to Superintendent Linthacum. Larry, we've had staff members and families ask, why not require all students to wear masks as an added layer of protection? This would be a simple thing that we could do to help control the spread. Many districts are requiring all students and all staff to wear masks. So it's not out of the norm, but why are we not requiring elementary students to wear masks except for on the bus? Or can you talk us through a little bit the decision of who is required to wear masks and when?
Absolutely, Ryan. We are requiring our staff to wear masks when they are not able to ensure social distancing. So that it's that area of determining that. I mean, today our participants here, we don't have a mask because we have social distancing, and hopefully folks can better understand us versus having a mask on. It was a consideration for all students, honestly, but DESE, the Department of Elementary and Secondary Education, they recommended not requiring the younger age children. So we landed on the middle school and high school students, but students may be asked to be in small groups or other close environments to wear masks where social distancing is not possible. And if parents want to send a mask with their elementary student, we encourage that if they choose to do that. So we're following DESE's recommendations on that, and we know there's varying opinions about that, but that is where we are as a member of, as a school here in the state of Missouri, where we landed with that.
Thank you. And yes, nobody will be prohibited from wearing a mask if they so. So the next question I want to send over to Chad Sooter. I know you talked a little bit about this already. It's something that we haven't put in writing and sent out to all of our staff and families yet. The protocol for the notification of either a positive case or quarantine, you went through it a little bit. We are working on that as a part of our documents for release next week as well, a decision tree and information and details that can be provided for our internal and external procedures to let you know specifically what our steps that we'll take is. But Chad, if you can just talk a little bit about that protocol for notification and who is responsible for contact tracing. Also, whether any negative testing will be required prior to reentry. I know Chesney went through that, but if you wouldn't mind just touching on that real quick again.
Sure. Thank you, Ryan. So basically, how the contact tracing will work, I am the primary contact for the Jeff City School District. And we are in the process of training a couple other people as well to help with that system. And so what will happen is, if you are a teacher, a staff member, a student, or a parent, you will contact your school principal and report that information to them, and I will be the primary contact for administration. So the principal will know to reach out to myself. I will then get the contact information for the student or the staff member and call them with questions that we have that I'm vetting through the Cole County Health Department right now. So I've sent that to them for review. So once I get the blessing for that, that'll be the process that we use. And that's what Ryan was talking about having that available by next week. And so what will happen is, whenever I am alerted of a positive case or a contact of a positive case, I will do what's called tracing, because there's a tracing and there's an investigation. So contact tracing is what we will do inside the school district. And the reason why we have chosen to take that on is to help the Cole County Health Department clear a scene faster, because we are not the only customer or client that they're having to deal with in the community. And so if we have an expert in our school to help gather that information, it will help us clear a school, clear a student, clear a staff member. It will help us clear the scene much quicker by having that resource. And so giving you a black and white answer of who will be contacted or how that will look, I can't give that to you because everything is going to be situational. But what I can tell you is that I am the primary contact, which keeps a closed loop communication and keeps it from being lost in the system and no one knowing about it. So hopefully that helps answer that question.
Yes, and I'm checking the time. It's 11:56, so we've got about another 5 minutes. See if we can squeeze in a few more questions here before we swap over to the student and family portion. I want to ask Shelby, and I know again that this is information that we'll be providing more details soon to the staff, but a question for you from an employee: if a school closure occurs and we are expected to teach virtually, what will the set of expectations be for both students and teachers? As teachers, we want to spend time prepping our students for these scenarios and working on what an extended closure will look like. So can you address some of that, Shelby, please?
Absolutely. One of the things that we've worked with building administrators on is to start those expectations from day one, not only for staff, but for our students and for our families. We believe in utilizing the tools that we have available to us. And right now we have Google Classroom as a platform where we can start leveraging technology in our lessons that are in seat. So should we have to go to a short term or an extended closure, we would be able to utilize Google Classroom as a means of delivering our learning opportunities. One of the things that we want to clarify is when we talk about distance learning will take place if we go into a short-term or long-term closure and the learning is facilitated by our district and our staff. Virtual learning is what we are using with Launch, which is an opportunity for parents who don't want to put their students in seat right now and feel their best option is to virtually educate their children. And that's what we're using through Launch. It's important when we talk about that, when we talk about virtual opportunities and distance learning, is to make sure everyone understands the difference. For distance, with our expectations for staff, as I mentioned earlier, learning will take place every single day. And what that specific schedule looks like, the content, how it's delivered, what the expectations are in terms of attendance and grading, all of those logistics will be lined out by building administrators. Instead of giving a high level from our level today for this purpose, every level is different: elementary, middle school, high school, and then based on content, it's different as well. So we having worked with the building administrators on what the expectations will be, and they will be delivering that information next week so we can start preparing in anticipation of a closure at any point so that we are ready.
Thank you, Shelby. I think we've got time for one more question. And then also I'd like to let you all know and commit to sending out information that we've compiled today for our Q&A, the answers to the questions that we've given, which of course can be watched back on our YouTube channel later, but also any of the questions that we didn't have time to get to. We will provide answers to them either directly to you if you're a staff member with a specific question, or as a whole for employees soon. Also as a part of that building level information that you can expect to get from your building administrator. So last question for the staff portion to Jason. Talk to us about the different furniture that's still being delivered, the plexiglass, if classrooms are still using tables, will they have plexiglass for those tables, and just masks and other delivery items, and just kind of a timeline of when we expect some of those things to arrive in buildings if they haven't already.
Sure. So I think I mentioned earlier that plexiglass, we've been told as of this morning, it's scheduled to be delivered Tuesday or Wednesday next week. We will get that put out. I know Frank worked with every building to go through class by class with each principal and determine what was needed. The desks are going to be coming right down to the wire. We're being told we should get them by the end of next week. So we then have to assemble them and get them in place. So if we have to work all weekend to have them ready for Monday morning, we plan to do that. Masks have been delivered to buildings already. We have at least 2 masks for every staff member. So you should get those when you come to work on Monday. Signs are being put up. Ryan, what else was there?
I think that covers it. Masks.
Hand sanitizer is in every classroom. Cleaning for the custodians. So I think we're on track.
Yes.
To go.
Thank you, Jason. And I misspoke. I do want to try real quick, Shelby, to hit one more question about the substitutes. And we've had staff members ask that, given that we had, a hard time finding subs, a bit of a shortage last year, and many of our subs are retirees who may be at risk, higher risk, how do we plan to handle teacher absences? Can you talk about that real quick before we jump over to the student and family section?
Sure. We received good news last week. The Governor Parsons accepted DESE's recommendation to lift the 550 rule. So that provides a lot more opportunities for some of our retirees who are willing and able to substitute more hours that they can serve our schools. We are also looking at ways that internally where we can minimize the number of teachers that we are pulling from classrooms that require substitutes. So we want to use our sub pool to help us in certain situations that might be medically related. When a teacher has to leave because their child's daycare is closed, we want to reserve our subs for those purposes. We also have dispatch to building administrators to let people know if you don't have students rostered to you, we may ask you to cover a class. We may ask you to step in and help. Our goal is to get subs there. We've been working with Kelly Services. They're confident that they have a strong sub pool and have taken our reentry plans. We've worked with them to go over our processes and procedures. So we're confident that we have a strong pool to start the school year. And we're making some internal measures, as I mentioned, to make sure we're minimizing the number of opportunities that we're pulling teachers out that we can prevent, so we don't have to tax our sub pool.
Thank you, Shelby. And I know one final question that we've had from both staff and families is about whether we'll have any training that's available on safety measures. And I did just want to mention that here in the communications department, we've been working on a social media campaign that we're going to roll out next week that focuses around the best practices for hand washing, social distancing, when to wear a mask, and things like that. So we will release those graphics to our employees for use in the buildings, and we'll have them on social media for families. So that'll be coming next week. So now that we're here just at the top of the hour, we're going to take a soft ending. Stay with us though, we're not going anywhere. All of our participants are going to join us for hour 2, but we're going to change our focus from our staff and employees over to student and families and some of the concerns that we've heard from them. So just as a reminder back to staff before you leave us, we will have information to share with you next week. As you come back into buildings, I'm sure that your principals will be able to answer some of the questions and address even more of your concerns. And then we'll have an email that we'll send out to all of you later this afternoon of this video and where you can come and watch it on YouTube if you weren't able to participate today or you had to jump off early. So with that, if all of our participants are ready to move on to hour 2, thumbs up. We would like to change our focus then to the students and families of the JC Schools District. And thank you again for joining us with our live stream session. So just in case anyone is coming on for the first time, I want to do a quick introduction again of who our participants are today, this morning. We've got Dr. Larry Linthacum, our Superintendent of the Jefferson City School District, Dr. Shelby Scarbrough, our Chief of Learning, Jason Hoffman, our CFO, COO, and Chad Sooter, our Director of Health Services. Also, we're lucky to have Chesney Schulte here this morning from the Cole County Health Department. I know Chesney will keep you as long as we can, but we understand you've got a lot going on in your world as well right now if you do have to jump later. So again, as a reminder, we've been collecting questions this week from our employees, from our families, and we've tried to compile them into some of the most common themes that fall under each of the areas of our participants this morning. So we're going to start off hour 2 of our live stream by having each of our participants just give a brief overview of their area and address some of those most common questions, about 5 minutes max per each person. We're doing good on time so far, so thank you guys. And then we'll start off here with Chesney Schulte to just discuss and give an overview of the current state of COVID-19 in Jefferson City, particularly as it might pertain to a family with a young student at home that's wanting to know, how do I give them the best information about what to expect coming back to school from a health perspective.
Thank you for having me on. Hello. I am a nurse with the Cole County Health Department and have had the opportunity of working closely with the public school system as well as all the district schools across the county. So that's been a wonderful relationship to have just between the schools, but then also with the health department. So I appreciate that. And thanks for having me on. As far as our work at the health department, I'll just walk you kind of quickly through what we've been doing with COVID-19 response. When we do get a positive individual who resides in Cole County, we do reach out to that individual to learn what symptoms they might be having or kind of what prompted them to get tested. In the 2 weeks prior to those symptoms starting, we want to find out where their exposure could have occurred. So for example, if they traveled recently around the state or around the country, or if they've had contact with a known positive case or a symptomatic individual, or if they have no known exposure to COVID-19 and have tested positive. The next part of that investigation is learning who their close contacts could have been, who those individuals are that we'd like to also make sure is aware of the situation and be able to monitor for symptoms. So that starts 2 days prior to their symptoms starting, and walking forward from there to learn who's been within 6 feet for 15 minutes or longer of that positive case. So we go through that process as well with that positive case. At this time, we have 87 active cases in Cole County, and that number reflects the individuals who have recently tested positive and they're currently under quarantine by the health department. Per CDC guidance, they're allowed to be released from quarantine once they've met 3 requirements. The first is that it's been 10 days since they first tested positive for COVID-19 or 10 days since their symptoms first started. The second is that they've been fever-free for at least 24 hours without fever-reducing medication. And the third is that they've had improvement of symptoms. So once all those 3 requirements are met, then they're released from quarantine by the health department. It's not required or supported by CDC that those individuals have to be retested and to test negative. So it's called the symptom-based strategy for release from quarantine. And that's supported by us, by DHSS, and by CDC. So that's what will occur for positive cases. Individuals who are exposed to that positive case, who are considered a close contact, are educated to quarantine, to distance themselves from others, and to watch for symptoms for 14 days after exposure. And that 14-day period is the incubation period of the virus, which is why it's set at 14 days, saying that you could become symptomatic and test positive anytime within that period. So those are the 2 timeframes that can be confusing to individuals. Both are accurate, the 10 days and the 14 days. They're just referring to different information about that virus. So the 10 days is the viral load, the infectiousness of that virus, versus the 14 days being the incubation period of that virus. So for how that might look in the school system. I think Chad will kind of touch on this later as well. It's certainly a question from parents and students of what that might look like for my student. We'll stick with the same policy, the same procedure for each positive case. However, it does look different based on different scenarios, different information we learn from that positive case. So that can be concerning to individuals or look like it's being handled differently. In fact, it's not. It's just that we learn different information from that positive case and act case by case. Let's see, as far as Cole County in general, we are reassured that the numbers of positive cases recently, while they are increasing, they're also many related to contact to a positive case. And the second source of exposure that we've seen is travel related. So when we have an individual who tests positive as a result of their exposure to a COVID-19 case, that situation is much less concerning because typically it's an individual that we are aware of, that we have educated to quarantine, educated to watch for symptoms already, and then they become symptomatic in that 14-day period and they test positive. So we're lucky that that's where many of our positive cases have originated, which is reassuring to the community as a whole. Another number that we like to look at is our positivity rate. In Cole County, it's about 2.7%, indicating that of the 100 people who get tested, 2.7 are testing positive. Another aspect of that number I'd like everyone to consider is that in Cole County, the tests are ordered based on, they do require a physician's order to get tested, and those tests are based on symptoms primarily. So asymptomatic individuals or people without a physician's order are not getting tested as easily in Cole County. So that number is reassuring also that that's the highest likelihood of individuals to test positive, and only 2.7 are. So at this point, I think I'll open it up back to Ryan, unless there's anything to talk on right now, but thank you for having me.
Thank you, Chesney. And we want to say again that we do appreciate the partnership, the collaboration that we've had with the Cole County Health Department all the way going back to March. It's been helpful to work closely with other schools in the community and with yourself and others at the health department to know that we're all in this together and get the most accurate and up-to-date information from you. So thank you again, and to the rest of your staff as well. We will move forward to hearing from Superintendent Dr. Larry Linthacum to give us an overview of our Back to JC Schools reentry plan.
Absolutely. Thank you, Ryan. Again, thank you, Chesney, and our Cole County Health Department, and the partnership that we have. We believe we're stronger together, and we appreciate and thank you, our families and our parents for joining us, and our community members. One of our 3 priorities this year is to engage families. And so we just add that to ensuring our learning and developing our staff. So thank you. We know these are uncharted waters. And we are so thankful for everyone on our staff and all the work that they've done. Being stronger together means different things to different people. And if there's any questions that are concerns that we do not address today that you might have, we encourage you to reach out to us. We recognize this is during the workday, and that might not be ideal for some, but we encourage you to reach out with any questions that we do not address. We surveyed our staff and our families, and overwhelmingly the response was that folks were ready to get back to school, to in-seat education. And this is something that we see as very important. You utilize the resources that you have. And here today, for example, we're doing this online, and we can do that, and it can be effective, but nothing replaces being a face-to-face and in-seat classes. We went through a process over the summer to consult with our local and our state and national health experts and organizations, other ed entities and other districts, and putting together all of that information to compile and prepare our own reentry plan. We looked at other school districts and what they were doing, and not only in Missouri, but across the country, and factoring a lot of things went into that. So our pillars of our reentry plan, number 1 is just our sanitation and our cleaning measures, ensuring a safe, clean environment to try to minimize. You cannot totally eliminate the germs, but try to minimize that as much as possible. Jason, I think we'll touch on that later with that. Number 2 is just the social distancing. 6 feet whenever possible, no less than 3 feet based on the CDC definition and the DESE and Missouri Department of Health recommendations. There are varying opinions about that, of what social distancing is, but that's a part of it. Number 3 is just our screening measures. When we surveyed our families, the number 1 measure that our families said they would feel more comfortable sending their child back to school is if we screened them and had temperature checks in our building. So that's something that we are doing. Number 4, the personal protective equipment, masks. We know that's most folks have an opinion about that, and not everyone agrees with that. But that is something that is an important part of a reentry plan, and we'll touch on that more here later. Limiting our visitor access. We do believe we're stronger together, and encourage partnerships, but we also recognize that that could potentially expose our staff, our students, so we're limiting that, and that's something that we're working through as well. Number 6 and 7 is just the virtual education. And if folks are not comfortable with our reentry procedures, we respect that, and they can opt to do our virtual option versus the in-seat. And then number 7 is just the procedures for what will take place in the event of a positive case. Chad Sooter and Shelby Scarbrough, they'll discuss that in more detail here later throughout it. So those 7 things are the pillars of our reentry plans, and that we're going to focus on doing those with fidelity as we go forward. But before I turn it back to Ryan, there is one certainty, and that certainty is this, that there are varying opinions on almost every single topic that we will discuss today, or that we already have. Those 7 pillars, most folks would have an opinion about that, including varying opinions from our healthcare professionals. You turn on the news, you get varying opinions and so forth. So we ask for your patience. We do believe we have a responsibility for the well-being of our students and our staff, and trying to find that balance to open safely, responsibly, and at the end of the day, ensuring the well-being of our community in the future, of our community and our state and our nation, honestly. And so I think that's an important part of what our role is in doing that in a safe manner. And these pillars, we believe, help us to do that. So that's an overview of it. We'll turn it back to Ryan. I know you've got some questions specifically for me, and I'll address those here later, but that's kind of an overview. And again, thank you guys for joining us.
Thank you, Dr. Linthacum. Just a reminder to anybody who is joining us this morning that the Back to JC Schools Reentry Plan that Larry was talking about with our key priorities is available on our JC Schools website, www.jcschools.us. So you can review that, download that, familiarize yourself with that as a family member if you haven't done so yet since the plan was released in July. We definitely encourage you to do so before you send your student back to school, and talk through some of the pieces of the plan with them too, so that they understand what to expect. Also, another reminder that as soon as we wrap up this live stream today, the full video will be available here on our YouTube channel as well. So you can go back and watch a portion if you missed it, or if you hear of a friend or a community member who wasn't able to join, they can watch this later on as well. It will be posted on our public YouTube channel. So next up is Dr. Shelby Scarbrough, who's our Chief of Learning. Her position includes the departments of elementary and secondary education, as well as special services and human resources. So Shelby's going to go over some of the most common questions that we received from families about the school environment and what learning will look like during the age of COVID-19. Thanks, Shelby.
Thank you. I'm happy to be here with all of you this afternoon. I think the burning question is what's school going to look like? And we hear so many different things are changing. It's not going to look the same as it has in the past. And I think the most important thing is we are honored that you trust us enough with your children. And there's 3 things that I can assure you that we're going to do. We're going to love your children, we're going to teach your children, and we're going to keep them safe. So with some of those pieces of school, our buildings have been working very, very hard to provide creative and safe ways to make learning fun, the classroom environments engaging, while utilizing all of the safety protocols that we have put in place. It's important for us to focus on our procedures, but it's also important to build those relationships. So as your students are coming to school, and if they have fears and anxieties, we know we need to explain to them why we're doing what we're doing, that school may look differently this year than they may have in the past, but we are going to do our very best to make sure that we practice practice, practice our procedures. So students know why we are doing them. And when we find opportunities to improve, we are going to respond, offer support, and make things better. We don't want to come from a place of punitive practices when someone's not following our safety protocols, because sometimes it comes from a lack of understanding. So part of our job as educators is to explain why we are doing what we are doing. Our buildings have worked very hard in putting plans together, and you should be receiving information from them on procedures that might look differently than what they have in the past. When buildings are looking at ways, they're always looking for suggestions and feedback. So I encourage you, when something doesn't make sense, you don't feel like you have enough information, to reach out to your building principals, reach out to your children's teachers, and find out why we are doing what we are doing, and offer suggestions if you feel there's something that we can do better. We can promise you that learning is going to take place every day. We know we have to adhere to the priorities that we've put in on our reentry plans, but we also are setting up our classrooms, removing furniture we don't need, having seating arrangements so that we can contact trace should we have the need to do so, but still holding true to the things that we believe to be important on good, solid instructional practices in our classrooms. It has been a lot of work, but we have people that have been working very hard who have stepped up to this challenge and are ready for your students to walk through our doors on August 24th. So we look forward to working with you, working alongside of you to make sure that regardless of the barriers that we face this year, we are going to bust through them and have an amazing school year.
Thank you, Shelby. Next, we will have Jason Hoffman, who is our district CFO, COO, talk to us about some of the questions that have come in regarding cleaning and disinfecting in the buildings, our transportation process and how that might look different this year, as well as meals and what different buildings might be implementing as far as changes in their buildings. So thank you, Jason.
Thank you. I'll start off with the cleaning and disinfecting. This summer, our custodians have received additional training on and additional expectations on how they need to be addressing our buildings. We've purchased an additional cleaner, and the cleaners have been delivered to the buildings and classrooms. And the specific cleaners that we've purchased are intended for uses in schools, health clubs, grocery stores. They're the same types of things you see as you enter a grocery store for you to wipe down your cart or those types of things. And the FDA has approved this cleaning for virucidal use. And so it is very safe for both our students and our staff, but it does a great job, and we have a tremendous amount of surface that has to be covered every day. So during the school hours, the custodians have been giving a route that they're going to be taking throughout the school building where they're going to be thoroughly cleaning high-touch areas. So, for example, in the bathrooms, they're going to be wiping down the flush, the water fountains, the walls, the entrances of the walls, the water bottle fill stations, doorknobs, entrances and exits, handrails and handles. And there will be in each bathroom, there's they're putting a record on the wall. And so each time a custodian goes into that building and says, I've touched the high touch areas, I've cleaned those, they're going to timestamp that. So, and they have a route where they're going to get through that, then they're going to start over again. So that's their routine for the day. We have turned off all the water fountains. They're not open, but we have added additional water fill stations. So water bottles, cups, that's how we're going to be encouraging students to get water throughout the day. And then every evening we have our night custodians will be going into each classroom then and doing a deep cleaning of each classroom through all the high touch areas and just hitting the classrooms really hard in the evening. So we don't really want our custodians entering the classrooms during the day. So we are going to need our teachers and our students to help us by wiping down high touch surfaces in the classroom. So we will have materials in each classroom. We have hand sanitizer, wipes, gloves for his teachers and staff and students to help us with that. In addition to each bathroom having a timesheet where custodians are going to write how often they're cleaning each bathroom, we're developing a checklist, and it's not just for cleaning, it's for everything that we've put in place, all the 7 things that Larry talked about. And so when when any of our administrators walk through buildings, we're going to ask them to use this checklist and make sure we are actually doing everything that we said we were going to do. And if we're not, find out why and put things in place to make that happen. As far as spacing, we did a thorough evaluation of every classroom in the district. Frank Underwood, our director of facilities, worked with every principal, looked through every classroom. We found out every piece of furniture that was in every classroom. We then tried to identify how many students do we think are going to be going into this classroom. We reduced the capacities of the classroom to make sure that we could ensure spacing. And so this was even before we had so many students sign up for virtual. We were saying, if everybody came and were in our classroom, what are the most people we think will be in these classrooms? And so made sure that we could still maintain this reduced capacity. And then we also looked at all the furniture in the classrooms and said, all right, well, we can't have a bunch of students sitting around a table, so we have to get these tables out and we need to order a bunch of desks. And so that's been done. We've ordered plexiglass for areas where we need to use desks, but still need to have separation. All of those things have been ordered. The latest we've been told is the plexiglass is being delivered Tuesday or Wednesday of next week, so we will get that distributed throughout the district, and the desks are being delivered by the end of next week. So it's coming in very close to the start of school, but we will do whatever we need to do. We'll work all weekend getting it put together and placed in the building so that it would be ready on Monday. So one advantage that we have as far as the distancing is we do have so many students that did sign up for virtual instruction. We have almost 1,400 students, so that's 16% of our student population. We expected them to be in our buildings and now they're not. So you figure that you could take our normal class sizes and it's spread pretty evenly throughout every grade span. So you can basically take about 15% of what our normal class sizes were, and it's been reduced by that 15%. So that's been a big help. It's because we haven't adjusted our teachers. We still have this, we didn't reduce our teachers at all. We still have the same number of teachers and even have added several teachers. We've purchased signage. We have social distancing reminders, mask reminders, and hand washing signs that have been delivered to the schools and will be placed up. Transportation. We still need to bus our students, but we have 16% fewer students because of virtual. And we've asked parents to, if they can, to transport their students this year. But we know that some students just don't have that. We still need to get them to school. But between the 16% reduction because of virtual, we just finished our routing and we actually have 26% fewer students riding the bus for the first day of school than what we had in previous years. So we've reduced our ridership by a quarter. So that will help with spacing on our buses. We've put other measures in place to where we're expecting them to load from back to front. We have a seating chart so that should we have a case, we know where everyone was sitting. We also know that we don't have students moving up and down the aisles. First student on goes to the back of the bus and they're not going to interact with students that got on in the middle of the route or the end of the route. And then when they get off, they won't have interacted with each other again. First student has supplied hand sanitizer at the entrance of the bus. So you will gel in and gel off the bus. Masks are required on the bus. We will have some disposable masks if a student forgets one, but we are going to need all students riding a bus to have a mask every day. And then a new thing that we purchased this year is a thing called Z-Pass, and it's a scanning. So each student that rides a bus will get a card. When they get on the bus, they will scan that they got on the bus, and then they will scan that they got off the bus. It helps in a lot of other areas, but as far as contact tracing, should we have a positive case, we can go and see immediately, was that student on a bus that day? If so, then we go to the seating chart and say, who did they sit by? It just makes our contact tracing so much quicker and easier. And then finally, our food service, it's going to look a lot different. Usually our students go through a line, they say, I would like this, I would like this, I would like this, and then it's served, and then they take that. It's going to be a lot different. We're going to be serving in different areas of the building, especially at the elementary level. The mornings, we're going to have bagged breakfasts. So the students going to come in, if they want breakfast, they're going to get a bag handed to them. They're also going to get a milk handed to them. And they're going to go to their classroom to eat. One of the other things we put in place as far as sanitation is we're not then, so that's going to be a lot of trash. So we don't want the custodians then going in and collecting that. So we've got big trash cans in the hallways. And so a teacher goes out, puts everything in the trash can, puts it back in the hallway. The next teacher comes, and then after they're done, the custodian comes and takes it away. And then lunches, again, it's going to be put together plates. So it's not, you'll get a choice of an entree, but the choice of the sides are not going to be there. Each student is going to get a tray, and then they're going to take that to their classroom and eat that there. So as far as meals, we're very close to having our meals done, and menus should be, for August, should be online, hopefully by the end of the day today. Anything else, Ryan? Not yet.
No, I don't think so. Thank you, Jason. And I know you mentioned Z-Pass. So just as a heads up to our families with bus riders, First Student is finalizing the route assignments, and we will have more information that's shared directly with families of bus riders next week. A little bit more information about that program. And so our last participant for this hour is Chad Sooter. He's our Director of Health Services. He's come to us from the Capital Region Medical Center, joined our district last year. We're thankful to have Chad with us as we navigate COVID-19. Really appreciate his knowledge as a health professional. And he's going to talk to you a little bit about some of the other implementations of procedures as it relates to health and safety for our students. Thank you, Chad.
Thank you, Ryan, for the introduction. Yes, thank you, everybody, for attending today and allowing us to talk with you. With the previous presenters ahead of me, you have heard about us putting in different layers of protection and different things that we are doing inside our school system to keep both our staff and our students safe throughout the day. Because we have to admit that this is a new normal for us. And like Larry mentioned earlier, we are stronger together as we go through this together. So some of the things I wanted to touch base with right now is more geared towards our parents, even if we do have some staff members still on the line. But I want to let you know that these layers that we have in place are for the protection of your children. There is a lot of things that go on outside of our school system that we cannot control. However, as soon as you trust your child and our care, we have these 7 layers of protection in place. Can I guarantee 100% that nothing will happen? No, but I can guarantee that we have your best interest in place whenever we are helping our kids get back to in-seat. And some of those things that we have in place, I'm sure you've heard about the thermal scanners that we have when you first enter into the building. And how those work is if a child were to pop positive with a temperature of 100.4 or higher, it doesn't necessarily mean that they are sick. It means that their temperature is elevated and we need to further triage them. And so what that entails is that the administrator or door monitor at that time will discreetly pull that student aside and send them to the nurse. And the nurse will then triage that student and then scan them again with an FDA approved thermometer. I can tell you that we have a great group of nurses here that I would trust with any of my children at home, and I trust them with your children as well. And they have been trained, they have all the tools that they need. They will be receiving a set of triage questions from me next week to help assess any type of situation. But we want you to know that even though we are coming back to school, we're going to make it as safe as possible. The next part that I wanted to touch base on are the masks. Something that we get a lot of questions on is how do we know when to wear those? And anytime you're not within your 6 feet or 3 feet social distancing, you need to make sure that you wear the mask. And that not only helps protect you, but helps the person that you're talking to as well. And the reason why we wear masks is to help mitigate the transmission of a virus, because you have to think about, we're not just dealing with COVID when we come back to school. A lot of our students will still get ear infections, strep throat, pink eye, other common colds, other things that aren't COVID related. So we are gearing up for a worst case scenario, but with all of our things that we have in place should help with our other illnesses too that are coming into play. So I'm really looking forward to seeing how all of our layers will help keep our students in seats longer during the cold and flu season, not just for COVID. And so with that, I want to explain a little bit about how COVID works. So, because I know we tend to forget about the other illnesses, so let's just focus on COVID right now. COVID right now is a droplet form, which means it travels about 3 feet in the air when expelled by sneezing or coughing or yelling or any type of where spit is expelled from the mouth, and it drops about 3 feet from that person. And so that's where the 6 feet guidelines come in play, is we know that if you get a power sneezer or a power cougher or someone that can really expel those droplets, we know that 6 feet for sure will keep you safe. Now, the recommendation with DESE and Department of Health and Senior Services know that classrooms aren't always set up for 6 foot distance. And so medical knowledge, we know that droplets fall at around 3 feet. So that is where that 3 feet guideline comes in from DESE and DHSS to help our schools get the most amount of students into our classrooms while maintaining that social distance. So if you hear the 3 feet, that is where droplets fall within 3 feet. So we're still safe at that time. I can't give anyone 100%, but what I can tell you is that we have many layers to help protect everybody. So hopefully that helps outline a little bit of why these layers are in place. One thing I want to touch on real quick, and I mentioned it earlier, is that there's a lot of anxiety about coming back to school. Okay, it's I can't go back to school because my kids are going to get sick, or we're going to get COVID, or something's going to happen. But I want to take you through a different lens to see through. Okay, you have the right to your feelings, and no one should downplay those feelings. We at the district will not downplay those feelings either. And that's why we have all these layers in place to try to help you navigate through that. There's a difference between living in fear and living aware. And we want you to live aware, not in fear. Okay, and so what I want to share with you real quick is that outside of school, we all have lives that we are living that we tend to forget about. We go to Walmart, we go to Target, we go to the gas station, we go to barbecues at families' houses, we have people over at our house. We go different areas, and a lot of times we might not wear masks. We might not social distance. And so that is something you have to look through your lens that, okay, yeah, I went to a barbecue, I didn't social distance, but I know that when I send my student to the school district, there's a controlled environment with all these layers of protection in place. So that is something that we want to be mindful of, that yes, we cannot control what's outside of the school, but what I can promise you is that we can help mitigate any risks that we have inside the school. So hopefully that's helped. Ryan, if there's anything I'm missing, just fill me in, but I think I'm good there.
Yes, and we're not advocating for anyone to go out and not social distance. I think Chesney would thank us for that if she was still here. They do still encourage social distancing, wearing a mask when you go to public places. And that what that is that's your part as a community member to also limit the spread and the exposure within our community, so that you do help to better ensure that when your students and our staff members come to school, that they're less likely to be carriers of the virus. I know, Chad, the only thing I think that you didn't cover that we've had a lot of questions about is maybe we can talk a little bit about, Chesney went into the quarantine process and a bit about their contact tracing process. Can you talk a little bit about that more specifically from the school angle, as far as what your efforts will entail, our communication process, and how we will manage the quarantine of those who might have been exposed or who test positive?
Sure, thank you for that reminder. So basically, how contact tracing is going to work is I am the primary contact for contact tracing within the school district. So what that means is when I am made aware that we have a positive case or contact of a positive case, I have a set of procedures that I reach out to that particular staff member, that particular student or their parents, and get information gathered in regards to who they were with, who they sit by, who were they in contact with previous 48 hours. And then I put all this information together, and then I reach out to Cole County Health Department, and we talk over a plan and recommendation on how do we need to address this in the school system. Once we get that information, we will then notify those who need to be notified, in regards to the contact tracing, because we have what's called contact tracing and contact investigation. So what I do is I help do the contact tracing, because being inside the school district, I can gather that information quicker and help clear a student or a staff member or a school quicker than someone from the outside trying to do that. So we work together to try to capture that data, get a school cleared, get a student cleared, figure out what we need to do, and get that message out to parents as soon as we know. Will there be a delay in messaging? There will be a delay in messaging, because we are at the mercy of being notified when that positive case happens. So, but what I can tell you is that being the primary contact, we don't have a bunch of hands in it trying to figure out who has the call, where's the call at. We know that everything comes to me, and then I do the tracing and contact the people that need to be notified. So hopefully that helps outline what we're doing. And it's not if we get something, it's when. And what I can tell you is that the process we have in place will work to the best of our ability to keep everybody safe. And I can't really give you a black and white answer that this is how every case is going to be. Chesney mentioned it earlier when she first introduced that every case is going to be different. And so we have to contact trace individually, and we can't just take it as a blanket statement, or this is how we're going to handle it. It could be where we might need to just shut down the classroom. We might just need to shut down a wing of a school, or we might need to shut down an entire school. I can't give you that answer until we know what we're dealing with as far as that. So hopefully that helps clear some of that up.
Yes, thank you, Chad. And I think it's a good time, maybe even for just a quick communications plug, to remind you that here at the district, we use a direct messaging platform to reach families via phone calls, text messages, and emails. Anytime that there's an instance that goes on in a school, your building uses that same platform to communicate with you. The contact information that we use for that platform is the contact information that you have on file for you as a parent guardian with Infinite Campus. So if you have any questions about where you will receive those messages, it's a good idea to check into Infinite Campus. Make sure that your contact information is updated. If you've gotten a new email address or gotten a new cell phone number, you can make those changes yourself in Infinite Campus, or just simply reach out to your student school directly. They can update that for you. And we'll be testing that system again as we get back to school this year to make sure everyone's receiving our messages. So now that we've heard from each of our participants, so we've got about 20 minutes left to dive into some of the family questions that we've received that we haven't covered already. Another reminder for our staff and families that we do have more information coming next week. We're finalizing a decision tree that will help you demonstrate some of those steps that Chad has outlined as far as what we will do if there is a positive case, who will be notified and when. And we'll also have some more information about our distance learning plan. As a reminder, we've got two kind of options going on. There's those students who have opted to enroll in our virtual education platform, which is Launch. And then if we were to have a temporary closure or an extended closure, we will utilize our distance learning plan. We don't have a switch that can be flipped on and off where a student can go back and forth throughout the year from Launch to in-seat. We have a small window of time where students can choose, if they're not being successful with Launch, to come back in-seat. But for the most part, those decisions that families are making now and at the start of school year is where those students will remain throughout at least the first semester. Like Jason talked about, we are making plans based on the enrollment and the capacity, and making decisions about classroom, outlined furniture and things like that, and busing based on how many students we have enrolled in Launch today. So moving on to our question and answers. Our first question I want to address to Chad Sooter. Back to you, Chad. We've had some families ask about performing arts, whether or not we'll be allowed to have concerts and performances this year, whether there will be restrictions to the number of people who can attend, or if there'll be other ways for them to utilize facilities for performances such as outdoors or larger venues. If you could talk a little bit about performing arts.
Thank you, Ryan. Yes, in regards to performing arts, we want our children to participate in as many extracurricular activities as they can while maintaining the social distance. And so does that include the performing arts? Yes. We want our students to be able to perform at the Miller Center. We want them to be able to participate in sports. We want them to participate in band. We want all of this to happen for our students because that's part of their learning experience. And so participating in extracurricular activities helps keep their social ability level up, be able to communicate with people, being able to do things outside of the classroom in a structured setting. How that will look, I can't give you that answer right now as we are currently looking at that, but I can tell you that if we do hold events, it will be maintained with the social distance aspect in mind. So hopefully that helps with that answer, but yes, we want our students to participate in as many extracurricular activities as they can.
Thank you, Chad. And I know that our activities department has been working hard on getting expectations and guidelines outlined for fall sports. We've had successful summer practices and activities going on. So we've been able to test some of those systems early and see that our procedures are working when it comes to limiting exposure, keeping kids in small groups, keeping socially distanced. So we will be providing more information in the coming days about activities for fall activities. Next, I'd like to push a question over to Dr. Linthacum. We know that some schools in the area, Columbia Public Schools, for example, have delayed reopening and pushed their start date back to September after Labor Day. So has there been any consideration given by the Jefferson City School District to doing the same? And if not, why not? Or if so, is that something that you would entertain?
Right. Thank you, Ryan. That's a great question. And we could have delayed. If the question is, could we? We could have, and we still could. Things could change. But as of right now, we are planning on August 24th here, as we have planned, considering many options. We know Columbia pushed their start date back. I believe Ashland or Southern Boone, they had already planned. They had planned the entire time to start there on September 8th. But you know, at the end of the day, when we consulted with our health officials, including Cole and Callaway County Health Departments, we made the decision to schedule it started on August 24th. I did receive an email this week from Desi and our state supervisor and asking schools here in Central Missouri when is their start date. And of all, there was 29 that responded. There were 2 that were after Labor Day, and that was Southern Boone and Columbia. The rest of the schools were the August 24th, 25th, 26th. I believe there was a couple of outliers. Fatima is actually starting next Monday. And then there was also an 8-11 school that's already started. So the majority of the schools, there are 2, as someone had referenced there, Columbia. You consider all those factors, but we just try and look here at our school district. It's no different than when we have a snow day. You know, folks have an opinion about that. And we look at our situation here while also considering others and what they're doing. But the most of them are starting the week there of August 24th, as we are as well. But if things change, we understand time is of the essence, as in the date today being the 14th of August, we recognize that, but at this time we're planning on August 24th.
Thank you. Yes, fluid and flexible, right, Shelby? We make our decisions based on the information that we have today. We've thankfully been able to stick so far with the plan that we released in July. But we all have to be prepared to change on a moment's notice if ever necessary. So Shelby, I have a question for you from a parent. The reopening plan mentions small groups. Can you elaborate on how small groups will be incorporated at both the elementary and secondary levels?
For elementary, we are minimizing traffic throughout our school buildings. So we're having students assigned to their classrooms, and that's where they will spend most of their day, except when obviously they go outside for recess or they have PE. We want to keep the units small so we know exactly where students are, who they interacted with, and what their day looks like. So our art, music teachers will be coming into the classroom, breakfast and lunch in the classroom. So it'll look very different than what students are normally accustomed to. So as I mentioned earlier, it's focusing on teaching those procedures. Why are we doing what we're doing and making sure they understand. At the secondary level, this is where the layers of protection become very, very important. Students are going to be traveling throughout the buildings. And I know some of the measures they're putting in place is one-way traffic, just making sure there's a traffic flow that doesn't allow a lot of congregated spaces where students can not socially distance. And when they can't socially distance, making sure they're wearing masks, but the traffic flow is fluid. We also are making sure that in classrooms that we have seating charts so that should we have to contact trace, we can easily remember who was in class, who did they sit by, who did they interact with, which helps that speed up that process to make sure that we're doing our part. One of the most important pieces in all of this are the fidelity checks that we will be making on what our expectations are for the classroom to make sure that if a teacher needs something, if we're missing out, if the hand sanitizer's out, making sure we replenish supplies or we get supplies that we need so we can make sure that we're adhering to those priorities we put in place.
Thank you, Shelby. Quick question for Jason Hoffman. The reopening plan talks about teachers going from classroom to instruct students instead of the reverse happening. But that obviously doesn't work for our high school age students. So will the rooms be sanitized between classes? Will there be hand washing stations, other things like that? I know you addressed some of that, but if you wouldn't mind going into a bit more detail about some of those cleaning precautions.
Right, and I mentioned at the start of my spot of the 11 o'clock hour, the commissioner said we're going to have grit and grace this year. And so that doesn't just apply to staff. We're going to ask our students to do some things that they haven't had to do before. And so in our reentry plan, it says that at a minimum, classrooms and other common spaces will be cleaned and disinfected anytime a new group of students assesses a new area. Cleaning materials and hand sanitizers will be placed in every classroom. Staff and students will be expected to support cleaning and disinfecting of classroom surfaces and supplies as needed. So yes, the answer is yes, that's our expectation that it will be, but we are going to need a lot of help in making sure that's done.
And I know that you addressed both hours, the type of cleaning products that we'll be using and that they are safe for you. So thank you for covering that. Next, a question back to Shelby Scarbrough. When there's a shutdown or if there's a shutdown, do in-seat students join launch, or will we be using a similar model that we used this spring during our closure? I know we all acknowledge that this is an area that we need to provide further guidance to families and staff as we get closer to the start of school, but can you give us an overview on kind of what will be expected and what a day-to-day class assignments might look like?
Absolutely. So when we talk about virtual programming, we are referring to launch, our students that are taking part in launch at the start of the school year. We need to clarify that when Ryan was talking about that short window, that if you are in seat and you decide you want to do launch within that 14-day window, it will be a fairly seamless process. Outside of that 14-day window for elementary and middle school, it will happen at quarter time. So at the end of the quarter, that's when we would have to make some decisions. So there may be a gap just because that's what we're working with launch. For high school students, since it is credit-bearing courses that we are talking about, that has to take place at the semester. So we want to make sure we're arming families with the information they need to make truly informed decisions on what's best for their students and families. So if we can provide more information about launch, we are happy to do so that you're able to make those decisions at the start of the school year. Should we have closure, we're going to refer to those learning opportunities as our distance learning opportunities, and those will be provided by our district and our district staff using our district curriculum. We are going to start day one, helping our students leverage technology in their classrooms. Our platform is Google Classroom, so how can we best utilize that platform to be able to support our learning opportunities as well as using lessons so that our students know how to navigate Google Classroom, and we can start supporting our families and understanding the capability that we have with technology through Google Classroom. We recognize that we were met with many, many challenges in the spring. We learned a lot of things. And so we have taken those learning opportunities and put some structures in place so that we can start developing lessons that we are able to do in seat and virtually when the time comes that we may have to do that. So just to clarify, distance learning will be provided by our district staff using our district curriculum for short and or extended closures, and our virtual learning will be taking place through launch, which is a separate from our distance learning opportunities.
Thank you, Shelby. And we will provide more information about that to families very soon. So a question for Dr. Linthacum, and I know Chad has gone into this a little bit, but just from your lens as superintendent, if someone tests positive at school, will parents be notified, and what will that process look like?
Yes, they will. Parents will be notified ASAP of a positive case. We will then work with the health department with the contact tracing, the close contacts to determine what children were potentially exposed and needing to be potentially quarantined. And if so, further communication will be shared with the families that are impacted. So it is turned over and working with Chad and our health department of what that looks like. But if there is an initial case, we will notify parents ASAP of that. And then if the kids that are impacted or students are impacted or staff through the contact tracing and close contacts, then they'll be notified from there. Chad, anything else on that, or is that covered in a nutshell?
I think you covered it just fine, Larry. I think that what we're looking at is the fact that there might be a delay in us being notified that there's a positive case. But what Larry just spoke about is that as soon as we are aware, communication will be immediate to make sure that anyone affected will be informed. So that was very good, Larry. Thank you.
Okay, thank you, Chad.
Thank you both. And I know from a communications perspective, we'll be involved in that as well to make sure, again, that parents receive that information via text or phone call or email. So question for Chad Sooter. You've covered a bit about the contact tracing versus the contact investigation portion that the Cole County Health Department will handle. But how will we monitor where, if there is a student who does test positive and we determine that they were symptomatic while they were at school, how will we determine where they've been, who their close contacts may be, and also who students that might be in their classroom or in their grade or in their same building who won't be impacted because they haven't come within close contact that 6 feet or less for longer than 15 minutes with that student who tests positive?
Thank you, Ryan. That is a good question to help the parents understand that. Earlier, we mentioned that our elementary students are going to be what we call a cohort or a family. And so what that means, I'm going to start with elementary first, and then I'll work my way through the different levels of school. But how that works for elementary, by us keeping them together as a family, if something were to happen in that classroom, we know exactly who those kids were with, and we know exactly who the teachers were with, we know where they went. So it helps clear contact tracing very quickly. Just because there's a positive case in a classroom doesn't mean that every kid in that classroom is going to be quarantined. That's where the tracing and investigation comes in. Now, if we're looking at the middle schools, the middle schools are broken up into wings. And so if something happens in the 6th grade wing, we're able to still operate with the 7th and 8th grade wing because we know that the 6th grades are in their 6th grade wing. And so that allows us to pull that student schedule. And then we're able to trace throughout the day, where has this student been based on his schedule? And then with the seating charts that we have in the classrooms, we're able to determine what level that classroom is affected. And then now that we're into high school, that will also be, scheduling will also be used to contact trace as well. We know that passing someone in the hallway, based on previous studies, there is little risk in passing someone in the hallway with contracting the virus. So we would not be as concerned about hallway traffic. However, again, if I am made aware that there is a positive or a contact within a school, I will meet with that building administrator, print out that student schedule, and we will walk through that student's day. And then that way we can get a good feel for what students or classrooms are affected. And then I will give that information to Cole County. We will talk about it on the phone, figure out the next level. And then while they're reaching out to the people that are affected, us on the school district side, I'm meeting with administration, meeting with our communications department, and we are working on the inside to get notification out to our families while they are doing their investigation. So I really do feel that we have a great system set up for this. Of course, we don't want to have to enact it, but we all know that that's probably going to happen. But I'm very confident in our process right now.
Thank you, Chad. And I know it just can't be overstated, the definitions for close contact that come to us from the CDC, from the Cole County Health Department. Someone that hasn't been within 6 feet of you for longer than 15 minutes will not be considered a close contact. So all of the layers that we've all been reiterating all day today are so important to that end, to ensure that we minimize any of the contacts, so that if there is, and when there is a positive case, that we truly do limit the exposure and we're able to keep up with our in-seat education, keep as many people in the buildings as we can while we move through the quarantine process. I want to pitch a question over to Shelby real quick. I know it's top of mind for a lot of families. It's very different this school year. It's unfortunate that we aren't able to hold those open house in-person events the way that we have in years past, and parent-teacher conferences. So how are the buildings working on building those relationships with families, familiarizing them with the buildings? As a parent, you're used to coming in with your student and walking to their classroom. That's going to look different this year. Talk a little bit about how that will be different and the importance of why.
Our buildings have been working really hard to come up with classroom videos or pictures that they can send, taking a virtual tour through buildings. Our goal is hopefully one day we'll be able to host an open house so that your children can show you their classrooms and you can meet their teachers and see how they spend their day. We are challenging our schools and our teachers to come up with ways that they can share your child's experience during a school day with you. I know some families have reached out. I always eat lunch with my daughter on her birthday. Well, how can we help you feel like you're a part of your daughter's birthday at school without coming in and eating lunch? So we recognize that this is hard, and we know that we have to step up to the challenge to make sure that you know that we are taking care of your children while being able to show you what their school day might look like, what their classroom looks like, where are they going to eat, what is PE going to look like, how is recess going to be. So we're going to hopefully utilize our social media, utilize our pictures, and communicate with families so we can start building those relationships. We're encouraging our teachers to reach out to families so they can introduce themselves to you, let you know who they are, what they're going to do, and how they can help meet your needs or answer your questions and minimize your fears about the start of the school year. So we're trying some new things. We're trying some things, doing things we've always done, maybe in a different way. But at the end of the day, we want to connect with you as our families. And so if there's ways that we can help meet your needs or answer your questions, we encourage you to reach out to your children's teachers, the building administrators, or any of us on this call so that we can help keep those connections going.
Thanks, Shelby. And before you step away, I want to have one more question for you. If a child is doing in-seat learning and they become sick and have to quarantine either from being ill or they're identified as a close contact, how will they receive education? Will there be recordings of their classrooms that they can watch or assignments that they can at home? Basically, how do we ensure that our students don't fall behind if they do have to quarantine from either illness or close contact with another student?
Which is a great point as to why we're focusing on leveraging technology in our classrooms, where we may be doing in-seat learning, but we may post lessons, we may put assignments, students may submit their work through Google Classroom, even if they are in seat. So then if they happen to have to be quarantined and they're not able to come to school, and it could be even if they're not quarantined, they may be at home with strep throat, they may have the flu and miss a few days of school, they will be able to access their learning. So those are one of the pieces that we're working on in classrooms at the start of the school year on what that might look like. We are going to continue to support learning if a student has to be at home, whether it's for a day, 2 days, 14 days, and each building principal is working with their staff on what that might look like. And again, for families is to communicate with your children's teachers if you have questions or wondering how they might get the work or how to access some of the information, because we're willing to work with you and partner with you, because we don't want learning to subside just because the student can't come to school.
Thank you, Shelby. So we are close here to the top of the hour, 1 o'clock, and we've been able to cover a bulk of the questions and the common themes that we have received from our families. So I think we're going to wrap things up and remind you again that we will have more information to share between now and the start of the school year, and also reiterate something that Shelby, I believe, talked about earlier. Just that buildings are putting into place specific procedures and details of how the reentry plan will be applied within their building. I know a number of them have released those plans to families already. And so you should be able to reference those plans if you do have specific questions about what back to school and reentry will look like in your student's building. If you haven't seen a plan yet, I'm sure they'll be sending it out soon. But also we would encourage you, if you still have questions, reach out to your school, communicate with the principal or the building secretary to try to get some of those more specific questions answered. And then we will be launching a social media campaign next week as well, with FAQs and reminders of best practices, how to talk to your student about hand washing, the importance of wearing a mask when you can't be socially distanced. What does social distance look like, and how do you stay at arm's length from your friends when you come to school? That will be different than it's ever been before. So to any extent possible that you as parents and guardians can help prepare your students for those differences before they come to us on day one, that will help considerably, because the strength of our plan lies in the implementation and the fidelity of our implementation. So that's a partnership. It's going to require collaboration. It's going to take all of us working together to keep those layers in place. And we're going to do the best that we can. So again, a reminder that this full video will be posted on our YouTube channel after we complete it and wrap up. So if you need to go back and look at something again, or you talk to someone who missed joining us for the live stream, then you can watch it as many times as you want later on. And then just here real quickly before we wrap up, I want to pitch it back to Dr. Linthacum to just give us a farewell and thank you all for participating and joining us today in our live stream session.
Absolutely. Thank you, Ryan. Again, thank you for everyone for joining us. Thank you for the participants. There's a lot of different parts to it, and I think we all recognize that. But we do have an opportunity. We do believe we're stronger together. Jason touched on that the commissioner shared about with grit and grace and what that looks like, and being fluid and flexible that Shelby touched on. All of those combined, these are that they are interesting times. They really are. But what an opportunity that we do have, and really see our resolve as the true character comes out when you're faced with adversity, as my mother would used to say. And hi, Mom, by the way, she's on here, I'm sure. But it is a true, we do have an opportunity. So thank you to everyone. We are stronger together as a team and as a community. And as we move forward through this uncharted times going forward, we're excited about the opportunity we do have. So thank you for joining us. Have a great day, great weekend, and we'll have more information here in the future.